Hello, everyone. It's my pleasure to welcome you to the fourth of 5 of our lecture series in the Spring Health Lecture Series. And I'd like to welcome Dr. Steve Levenberg, who is a doctor of osteopathy. He has worked in Santa Rosa area in Roanoke Park in County for 30 years in family practice. And he is born and bred here in Sonoma County. So, Steve Levenberg.
Thanks to the Senior Center for having me. So many things that we do are built on the building blocks of giants and those who came before us. And Mitch Savitsky is here and has given this particular presentation previously, and I leaned rather heavily on his previous notes in his presentation to do this. It's a topic that lends itself. It's pretty much fact-based, so it takes itself where it needs to go. But I had good notes to start with, and hopefully we'll have a good result here today. A couple of disclaimers. I'm not going to give medical advice. I'm not going to go through your medication list and tell you what you should take and what you shouldn't take. I'm going to recommend that you take your questions and formulate them and take them to your doctor and work through that list to see if there's anything that is any cause for concern. There was another disclaimer. I've forgotten it. I'll get to it. I just wanted, as we start, to sort of define what we're going to talk about. I don't intend just to talk about prescription medications, because prescription medications are not the only thing that might pose a risk for falls. It's all the substances that we ingest, either orally or nasally or through our skin or any other way they might get into our system. And they all can interact. They all end up in the same place and can all interact and affect our ability to move safely and control our balance. So that's really, we're going to talk about the whole spectrum of things. So falls, those of you who have been at previous presentations in this series realize that falls are really dangerous and important. They affect large percentage of people over the age of 55 or 60 or 65, and get more and more common and more frequent as we all get older. Said that maybe 1 in 4 or 1 in 5 individuals over 65 will fall in a year. The toll of emergency visits is in millions. The number of hospitalizations that result from falls is somewhere between 750,000 a year and 1 million. And falls can result in not only serious hindrance to your life, but some people die as a result of their falls, or they're permanently affected in ways that make their life much less effective, much less happy, and can cause a great burden. It's also estimated that the cost of caring for the results of falls in this country is somewhere in the range above $50 billion a year. That's a tremendous number. That's a tremendous number. So any falls we can prevent through the whole course of this series, or if you hear something today that helps you make a change that makes you safer and helps prevent a fall, it's really important. Medications are important because you see here, 72% of individuals over the age of 55 use at least one prescription medication. Percent of individuals in those age groups are using 4 or more medications. It's a tremendous number. And why is it important? Why are we talking about this with older people and not so much with younger people? Many of these substances can affect younger people too, but the effects get to be more magnified in older individuals because of a few changes that happen to our physiology as we get older.
A few?
A few. Yes, I was just going to say, every one of you can probably describe to me, if not one, maybe 4 or 6 or 10 things that have changed with you that weren't the case 20 years ago. And those things add up. But there are a couple of important changes in older people that interact with substances that we ingest that can make a big difference. In our body, there's a balance of space. There's water space and there's fat space. And as we get older, you probably recognize this in some ways, the balance of fat to water tends to increase. And so there's for medications and other substances that get into our body that have to be distributed in water, there's a smaller space. So the amount of something that might have been distributed in you 20 years ago is now distributed in a smaller space, so it can have a greater effect. The same is true with that fat space. If there are things that you're exposed to or ingesting that end up concentrating in fat, there's just more fat there, and we all recognize that, all know how it affects us. And so there's more potential space for those substances to be concentrated. The other really important thing is changes in our organ function, especially in our kidneys and liver. The kidneys especially. I mean, probably every one of you have been to the doctor and have talked about what your creatinine is. So your creatinine is less than such. And some of that is age related. Some of that change is age related. Our kidneys get less efficient as we get older. And some of it can be affected by medications. But when that happens, our ability to filter out those substances gets less and less and less if those are substances that are filtered by our kidneys. Now, other substances are processed through our liver. And the liver is a little bit resilient and has greater reserve capacity than our kidneys. So most people don't lose the capacity of their liver in the course of their lifetime unless some disease or bad batch of mushrooms comes along, in which case you get a new liver or you die. But liver function can affect the way we process substances too. And those are primarily the big changes that occur as we get older. This is a busy slide with lots of words and names and all, which is really just intended to remind us that there has been rigorous work done over years. In the 90s, the Beers criteria were developed, looked at the whole constellation of medications out there and put those that seem to have the greatest possibility of causing problems in older individuals into a list, and their category, they're ranked. And what I don't want you to take away from this is to think that just because a medication is on that list as being potentially inappropriate for use by older individuals, we can't take away the message that this is a bad thing. What it means is that each one of these things has to be evaluated in the context of why we want to use it, what the condition is we want to treat, how we have to modify the dosage to keep it safe, and how we have to monitor it to make sure that that continues to be the case. But you'll see down here in the bottom half of the slide that many familiar and common medications are on that list. There's Lasix, there's hydrochlorothiazide, there are blood pressure medicines, ibuprofen, and then there are sedatives, hypnotics like Xanax and Levenberg, and ulcer medications, Tagamet. So it's a true laundry list of medications. The list is important because it acts as a caution sign. It's like the yellow light. Yellow light doesn't mean to speed up, it means to take caution. So this is just a reminder that the risks that we find with medications are not simply additive. That if one medication poses one quantum of risk, two medications does not necessarily pose just two. It might be 4, and the third one might be 12 instead of 3. And as we combine multiple medications, the predictability of how they will interact and what they will do gets to be less and less reliable. As we add more and more, we just can't know exactly how they'll interact. We have computer algorithms and programs as we practice that help us determine whether this medication might react with this medication, and might be able to tell us if this medication will react to these two. But each time we add one, the calculus gets more and more complex and it gets more and more fuzzy. So it's just a reminder, as you add more medications, you have to be more and more careful. So if you have some place to be at 2:50, here's your chance to get out soon. Here's the take-home message. If you're taking medications, ask your doctor if you have concerns. Do I have factors and medications that increase my risk for fall? Am I taking medications that increase my risk for fall? If so, is there something we can do about that to change that and make the risk less? And the last point, am I taking any over-the-counter medications or supplements that might also interact with that? I'll tell you a little medical secret that in my practice life, I was not very good at asking about these things. And the body of knowledge about over-the-counter medications is fairly good. The body of knowledge about supplements is not very good. And it's extremely complex. And I was talking to Tom just before we started about the reliability of what you get. When you go to the pharmacy and you get a prescription for 100 milligrams of XYZ assigned, you can be pretty certain that you're getting 100 milligrams of that. When you get whatsoever root at the farmer's market, you can't know what you're getting. You can know with some degree of certainty, but you just can't know with a high degree of certainty. So you have to be careful about those. Maybe a complex conversation with your doctor about those. We all have to be patient with one another and just try to work through those things. But that's the take-home message from today. We're going to go through a laundry list of lots of names of medications and lots of things. They're mostly there to tease our brains about, oh, is there something on my medication list that might pose some concern? I need to ask these questions. Okay, so now we dig a little bit deeper into this, and the things that can affect balance to the highest degree are things that affect how our brain works. There are some things that also affect how our muscles work, might affect that, but primarily the things that will really get you into trouble are things that work in your brain. And I put antihypertensives in here that maybe doesn't belong on a list of things that affect your brain function, but the other things do. Sedatives and hypnotics, which are the sleeping pills or the anti-anxiety medications, opiates, the pain pills, antidepressants, antipsychotic medications. Antipsychotic medications are a whole potpourri of things that can go haywire in our brains that cause us to need help rebalancing that chemistry. And then there are some other things that we'll talk about that also can have some effects on our brain. But the things that get us into the biggest trouble are things that affect our brain. We all need to have our brains turn on in the morning to help us get through the day. If they turn off before we go to sleep, then you're in trouble. Okay, so sedatives and hypnotics. They're used for sleep and they're used for anxiety. Their effect primarily is to decrease brain function. A perfect example of this, something that's not used for sleep or anxiety, but muscle relaxants. Not all, but many of you probably have had experience with or have heard of muscle relaxants. Well, muscle relaxants primarily don't do very much to muscles. They work by sedating, so that the muscle doesn't have quite as much stimulus. But that's a good poster child for what these medications do. They generally work by suppressing brain activity. And you can imagine what will happen if you do that. You get sleepy, you get dopey, you get clumsy, and as a result, you may fall. So that's why they're so important. Because of those changes in our physiology as we get older, they can be especially potent in older individuals. And because some of them end up in fat, not water, they can have a more prolonged effect. So these are the examples of those medications. And many of you, most of you might recognize one or the other. Ativan is Valium, Restoril is used for sleep, Delmain is not used very much anymore, but as I was growing up, as a young doctor, we used Delmain plenty, calcium, Cirex, Transine, and then below here that some older medications, the barbiturates, they're very highly addictive. They're not used very much anymore, but they're still around, so you may encounter them. But these are things that should prompt a robust conversation. Do I really need this? Am I getting the benefit that I want from it? Is there something else we could do to try to get the effect? Some other way to deal with this? So another class, these are very commonly prescribed medications, antidepressants. They're also used for anxiety. And the most prominent group of these medications are the selective serotonin reuptake inhibitors. We call them SSRIs. Prozac was the first of this class of medications. And there have been many years in the past when it was the most prescribed medication in the United States. They're generally safe, generally pretty well tolerated, and they're used for a lot of different things, not just depression, not just anxiety, but obsessive compulsive disorders, eating disorders, premature ejaculation, pain syndromes, and lots of other things. Many times when there's puzzling, I use a bit of jargon, puzzling somatic, musculoskeletal aches, pains that we can't sort out any other way. Sometimes the tendency, well, let's just try this and see if it affects it. Because sometimes it does. And generally, these are safe, but really require some caution and care. And I suppose that's my other take-home message, aside from having that conversation with your doctor, is just, this is not an absolute prohibition to medications or other substances. It's just a yellow light for us. Be cautious. Think about what the benefits are. Think about what the risks are. Think about how it's affecting you. So the examples of these medications, Celexa, Lexapro, Prozac, Paxil, Zoloft, Luvox, and they're very common. These stack up this entire group. They make up a huge percentage of the medications prescribed in this country. They can cause interactions, and they can induce changes in our metabolism that then will affect the way other medications are processed through our body. So this is a perfect example of where the interaction can be important, even though neither one of the two medications you might be comparing, it's just their interaction may require adjustment of dosage or might cause you to look for different alternatives. Here's one of those effects of an herbal supplement. St. John's wort is an herbal substance that can have beneficial effects for depression and anxiety. The problem comes in, once again, not knowing how much of what is there, and if it's combined with one of these medications, it can multiply the effects and lead to serotonin syndrome is subject for a whole other talk. It can cause a serious interaction.
Excuse me, what
Yeah.
does enhanced caffeine effects?
Oh, it makes caffeine more effective at what it does. Alertness, jitteriness, irritability. Yeah, so it makes it more effective, which in some cases might be good, but you really don't want to. I don't think you want to use one of those medications to try to decrease your coffee consumption. This is the tricyclic, heterocyclic antidepressants, or a different class of antidepressants. They tend to have been the first antidepressants and have many more side effects than the SSRI, the serotonin related medications. They cause more drowsiness, more confusion. They affect movement. They cause a lot more drug interactions, and we'll talk a little bit more about anticholinergic effects. They're really something that we need to be very careful with in older individuals, because not only do the medications themselves cause some pesky side effects, but they can result in a lot of interactions that then cascade out of control. These are names. Elavil probably is the most common name in that group. Amyl or nortriptyline is also fairly common, but these are less commonly seen, but require a lot more caution. And they've been supplanted by safer, less troublesome alternatives, the ones we just talked about. Pain medications are great when used in the right setting for the right length of time. They're primarily very effective for the short term, as short as 7 to 14 to 21 days. And after that, then you start to deal with the effects of tolerance and dose escalation to get the desired effect. And once you start having to escalate the dose to get the desired effect, you're really running out of your safety profile pain medication. But even under the best of circumstances, even during that first 5 to 7 days after you've broken your arm, when they can be tremendously effective and tremendously helpful, they can cause problems. and drowsiness, confusion, loss of balance in sufficient quantities, nausea and vomiting, and they really produce a lot of constipation, especially with longer term use. So once again, the yellow light is on. You have to use caution, and you have to be willing to work with your healthcare providers to find the right balance when you need these things. The examples of these medications are listed down here. It's Norco, Vicodin, OxyContin, many others. Yeah, very useful, but require caution. So, anticholinergic effects. Now we're digging deep into the physiologic weeds. Acetylcholine is a chemical in the body that modulates and regulates chemical processes. When its activity is suppressed, you get panoply of effects. Dry mouth, dry skin, retention of urine, constipation, confusion, dizziness, increased heart rate, all kinds of things. And there are lots of different medications that can have anticholinergic effects. Here are some of them. Put in red, antihistamines. Antihistamines can have very potent anticholinergic effects. And they are ubiquitous. This time of year, Sonoma County, people have allergies, and Benadryl is available over the counter. And sometimes what happens with allergies is if one is good, then maybe two might be better. And so pretty soon you've compounded the problem. And antihistamines are in multiple cough and cold preparations, so they may be hidden, and you may experience the beneficial effects of those cold and cough medications, but you also might experience the drowsiness and the dizziness and the dry mouth, other things that go along with it. So up here, the tricyclic antidepressants are right at the top of the list in terms of their possibility of causing significant anticholinergic effects. The antipsychotics and the anti-epileptics, things that are given for seizure disorders. So those are things that, once again, the yellow light is on. You really have to be careful with those, and you have to ask the questions. And here, there are other medications that have some anticholinergic effects, but much less. And so it's not their major risk feature, but could be important if combined with lots of other things. So, are there others? Oh, yes, there are others. Antihypertensives, medications that are given for blood pressure, can have some definite effects on balance. Primarily, if they work too well. If your blood pressure is high and the medication you're taking for your blood pressure drives it too low, and you stand up quickly from a chair, you will be at high risk for fall. So that's one effect. When we frequently combine more than one medication for blood pressure because you get a better effect with a lower dose of each one of the two components. But there are some increased risks. With younger people, we very often combine medications like the ACE inhibitors, Tensin, Zestril, Vasotec, with a diuretic, especially hydrochlorothiazide. The difficulty with diuretics in older individuals is, once again, you have a smaller water to fat ratio. And so when you start to get rid of fluid, you put yourself at greater risk for dizziness or falls, especially if you get hot, if you sweat, if you stand quickly, if you get out of bed without slowing down before you head off across the room in a dark room, you're at greater risk of fall. So these medications all pose some risks, but of all the medications that can affect balance, antihypertensive medications probably are the ones that are most carefully monitored. We monitor blood pressure frequently. More often than not, undershoot our goals for lowering blood pressure. But if we overshoot, that can cause problems. But they are, as I said, they're usually monitored so that the benefits outweigh the risks. Once again, the yellow caution light is on. Maybe not as bright for these, but they can cause problems. There are other medications that can cause significant problems. The third on here, the sliding scale insulin. Sliding scale insulin is regular insulin that is given in varying amounts depending on what your blood sugar is or what you suspect it is. And the real problem is that if you overshoot in terms of the amount that you give, it can cause you to pass out, put you at great risk of fall. The proton pump inhibitors like Tagamet, Previs, and others can over time decrease your bone density and make fractures more common, and hip fractures are a common source of falls in the elderly. So anything that makes that more likely can put you at greater risk for a fall. And then the anti-Parkinson's medications, because of their effects in the brain to affect movement in combination with the presence of Parkinson's already, can just make the risk for falls much greater.
That was supposed to not be though.
It is, but you've struck on the point that's true of all these medications. We always have to balance benefits and risks. And the Parkinson's medications are designed to correct the metabolic condition that creates the movement disorder. But they can also have downside risks. So it's a balance. And especially when you're treating a movement disorder, the balance for falls is maybe a little bit harder to negotiate. So there's no absolute free lunch in terms of medications.
That's why I'll take
You're lucky. So the other thing I wanted to touch on is alcohol and cannabis. Substances that are now cannabis is ubiquitous in our culture, and alcohol has been for not forever, but for a long time. Both substances pose great risk for balance and increasing fall risk. The effects of alcohol are heightened in older individuals because of those changes in our metabolism and our body makeup. And the effects of cannabis need to be monitored carefully, but sometimes can't be fully evaluated because they're very subtle. And also that shift in water to fat in us as older individuals can cause greater possibility of accumulation of cannabis metabolites in our system. Might cause them to last longer or to be heightened over time. So just, important not to see this completely as prescription medication. There are lots of things that are ubiquitous in our lives that can cause similar risks. So here we are, back home. I think no one took the bait and left at 10 minutes to 3. So we're right back here at the take-home message. If you've seen something today in this laundry list of weird names, if you've heard something that struck a chord, that doesn't sound quite right. The action to take is to get together with your doctor the next time you're in and just ask some questions. Ask them, am I taking anything that might increase my fall risk? Is there any alternative to that? Do things different. And make sure that you're clear and open about the over-the-counter medications that you may be taking and other substances that are part of your regular life, so that you can start to have that conversation of mental gymnastics that might evaluate all those combinations of risks and hopefully reduce your fall risk. So I'm happy to take questions if I didn't cover something. Yeah, please.
Do psychoactive stimulants also have an effect on our balance? Like, it's like we mentioned, caffeine, we're jittery and moving too quickly.
They can. Yeah, the question was about stimulants, psychoactive stimulants. The effect is probably not quite as profound, but it certainly can have an effect.
It does affect the brain.
Yes, yeah. And to the extent that the stimulants affect judgment, and that may be a real problem.
For me, like I'll get really dizzy and my ears will ring if I've had too much caffeine, and that might affect my judgment.
You bet. Yeah. Other questions?
Seems like a lot of specialist doctors are asking you to list all the drugs. Sometimes we wonder what they're doing. That's not the real question. What is the role of the pharmacist? If you choose to buy a then how good are they seeing process compared
Steve, could you repeat the question?
Yeah, the question was about listing all of your medications when you see various physicians, and then extending that out. What's the role of the pharmacist and pharmacy in helping navigate that list of medications? And you hit on something that's really important that in some ways has been lost a little bit over the course of time. Pharmacists have the training and are in the right place to help make that complex determination about whether there's something that may pose problematic interaction. But over time, their time has been divided to do less counseling and more prescription filling. But you know that every time you get a prescription, there's the opportunity for counseling with the pharmacist. So that's the opportunity to say, do you have time now to look at my list of medications and help me figure out whether there might be something that may pose a serious interaction? Or can I come back on Tuesday morning at 9:30 when you're not busy? So there is that opportunity. And that's a good use of pharmacists' time, if we can get them to do it. I mean, I think they're in a good position to do that, because if you get that's the real advantage of getting all your medications at the same pharmacy. So sometimes the specialist only sees the medications that they have prescribed, and not the medications that the psychiatrist prescribed, dermatologist prescribed, cardiologist prescribed. But they all come together at the pharmacy. So that's a great question. In the back.
Is there any database you can go to and plug in all your medications and supplements and then have it spit out where it's like see some flags that you could discuss with your doctor or your pharmacist? Like that would be great.
There are.
Is that something that we can access?
I think so. I have not tried to do that recently, so I can't say that I'm up to date on the names of those, but those certainly exist. Yeah. Yes.
Instead of taking sleeping pills, what do you think about that? Melatonin?
Well, no, once again, I'm not here to
Oh.
give specific
Oh, okay.
advice, but melatonin is it's a supplement. It's produced by the pineal gland, our deep in our brain, and it's a trigger for sleep. Its most important studied uses are for jet lag adjustment and work shift adjustment. And it doesn't have great data to recommend it for everyday sleep supplementation.
So when you're taking one or more of those medications that were up there and say some supplements on top of that, the reason that you may fall is because you're dizzy or something from those, or is it because your brain is not connecting with your feet and telling them to move, or to lift up the stair or something like that? Is that?
All of the
cause?
above plus 12 other things. And yeah, that's it's. Well, falls are difficult to evaluate in terms of deciding exactly whether there was a discrete reason for the fall and evaluating what a combination of medications might add up to or multiply to is also very difficult. So the answer is yes, all of those things plus maybe 12 others. John?
How come, if you take melatonin every day, what can happen if you take melatonin every day?
Well, generally, if you're taking a reasonable amount, probably nothing will result.
So, I don't know if there's any effect taking some medication for Parkinson's and blood pressure at the same time with melatonin.
Yeah, I don't know if I can comment specifically about whether there are medication interaction risks. Yeah, that would require going to the database of medication combinations to see if that melatonin at low doses that are usually used to try to help with sleep, melatonin is fairly safe. But then combine it with 3 other things. Who knows?
Yeah.
Yes.
Is something like Fosamax interactive?
Well, it certainly can be. Primary concern is that while it's there to try to help build stronger bones, we know that the class of medications from which Fosamax comes can have some serious opposite effects if they're taken for too long. So that's the primary concern. And if you're taking anything else that might affect the calcium metabolism in your body, along with Fosamax, that could be a potential for interaction. Anything else? Well, thank you for your attention.
So much. Thank you very much.
So thank you all for coming. We have one more lecture in the series. It's next Wednesday. It's primarily targeted towards people who are caregivers, either in an informal sense or in a formal sense, and it's about caring for the caregiver. Now, possibly in the fall, we will be reviving some of our fall prevention, either lectures or workshops or whatever. And if you have ideas or suggestions for things that would lend themselves to an expert presentation, please let me know. And there's a lot of handouts there on the back table. And thank you for coming.
Thank you so much.